The Ron G Morning Show, every Monday through Friday at 7 a.m. only on WSAN Radio, the soul of America. All right, good afternoon, everybody. Oh, y'all are in for a treat today. We got a new facility opening up on the south side, much needed. And here in the studio today, I let this young man introduce himself. Introduce yourself.
Hi, I'm Dr. Hussein Musa. I'm the founder of the Kingdom Healthcare System. We have a mission to provide free and affordable access to care for those in need.
And you know, you're opening on a side of town that is much needed. And I applaud you for doing that because you know, if you go through, if you think about it, a lot of business don't want to open up on the south side and the east side of town, and that's in all major cities.
Yeah.
And it's a stigma about it. And you know, for you to do that, I really appreciate it because the stigma is done. It has never been one. I think the media made it like that. And but we need that, and I am so glad you're opening up that everything. So tell everybody, what day are you opening up?
So we're having our grand opening on Monday, March 23rd at 12 noon. Now, this is a time where you get to meet some of the volunteers, meet the physician, meet the team, and see the facility. Now, granted, the space is still very open. We are a nonprofit, so a lot of what we are able to provide is based on donations and funding. So we're going to grow and expand as we gain more donations, but we don't want that to delay us from serving people. So when you come in, you'll see there's needs where we still need some furniture, some other items, but we plan on seeing patients starting Monday, March 30th. And if you come to the grand opening, we'll have volunteers there available to help sign you up for a clinical appointment. Now, currently, we are going to provide basic primary care, simply meaning that we can do medication refills, we can counsel you regarding your health, we can also do physical examinations, and we can also refer you to other doctors or other facilities in San Antonio that can help you with more complex health needs. Our main mission is to provide access. We believe that providing early access to basic preventative primary care can prevent you from developing chronic illness and avoid the high cost of emergency room or emergency department or hospital admission. So, my average patient, they typically see me because they were unable to afford an appointment with their doctor. They just lost their insurance, or they need a refill on the medication and it's been several months and they don't want to go to the emergency room or purchase something else. They know what they need, but they just can't get it. And what I found is a lot of the medications that we use to manage chronic illnesses, they're on very affordable formularies for most pharmacies or even mail-in order pharmacies. The vast majority of high blood pressure medications, diabetes medications, cholesterol medications, there's often $4 corollaries where you can get medications for under $10 that can help control your symptoms rather than allowing them to progress month after month without any intervention. And then before we get to that point, let's say you go to a screening event. One of our partners, the Texas Kidney Foundation, they do health fairs where they're screening patients for kidney function, for diabetes, high blood pressure, and high cholesterol. And let's say you go to a screening event and you find out your numbers are really high. What do you do? Well, now you could come see us at our clinic and we could get you started on treatment. But more importantly, we can start getting you involved in nutrition and lifestyle modification so that you don't progress to chronic illness. My vision is to have multiple clinics in different zip codes in San Antonio that gives you easy access to a healthcare professional so you can answer your health questions. You don't have to wait and be scared that, oh no, if I go to the doctor, something wrong, and now I need to do something about that. We want to change that concept. We want to make it easy to seek healthcare and not just Google or Chat GPT, talking to a real person who has real knowledge, who can guide you and can alleviate those fears so you can make a decision that is beneficial for your health.
You know, you touched on points there. There's a lot of people are scared to go to their doctor because they're scared like, what they're gonna find out. But
Exactly.
you know, you need to find out, what's going on, because it may not be as bad as you think it is. Because sometimes we get it in our head that, man, I'm gonna go to the doctor. They're gonna put me on this, put me on this, put me on that. I'm not gonna go. And then the time with people of color, the time they go to the doctor, I hate saying this, sometimes it's almost too late. And when they go and they see what they have right now, that could have been prevented years ago, but you wait to the last second to go, and then they get the bad news. Then they say, that's the reason why I'm scared to go to the doctor. Well, you waited too long. So, how do you address people who are scared to go to the doctor?
Well, an ounce of prevention is worth a pound of cure. But if you are scared of going to the doctor, listen, fear is a terrible master. It doesn't serve you in this point. So you just have to move past the fear. And the good news is, our clinic, we're very friendly. We're faith-based. We don't deny anybody care, but the main reason we're doing this is because this is a mission from God that called my wife and I and a lot of volunteers who've linked arms beside us to serve the community because we want to show the love of God to all people through healthcare. So you're coming into a warm environment. It's not your cold, unfriendly, uncaring traditional clinic environment that a lot of us have experienced with our healthcare system. And you're not just a number, you're a person, you're a living soul, and we want the best for you. And if we can't help you, you better believe we're still going to pray for you if you so like. And this is a way that we can build a rapport because if we build a relationship with our healthcare team, when something comes up, now you have a safe place to ask questions. So many things happen and progress because there's not a safe place to ask questions. Or if you're asking questions, you're asking the wrong person or you're asking a computer and you get answers that may or may not be the best for your health.
Yeah, you said that because standardized testing, when they say at a certain age, just what you have with diabetes or high blood pressure and all that. So I asked somebody, a doctor one time, I said, how do they come up with the numbers? She said, what do you mean? I said, they come up with these numbers that you got to be, let's say 9.2 sugar level, all that stuff they
That's
tell
high.
you. I said, how do they come up with them numbers? She said, what do you mean by that? I said, well, I'm black and I'm pretty sure my numbers be different. Do they get numbers from all people that are white and say these are the standard numbers? Because they're not really standard numbers when you go throughout your community, Hispanics, blacks, Oriental, things it changes. Like I, somebody told me we could tolerate, blacks could tolerate a lot more pain and all that. I met a dentist one time. It was at one of the health fairs that I met you at that said the black roots are longer than standard roots in the teeth. I said, you kidding me? She said, no. So I'm learning more and more about my roots by talking to um, black men and women in the medical field. So I guess my question is, we are different. We should be treated different. And a lot of people will sit down and tell Ron, you don't know what you're talking about. Well, I talked to quite a few people, and I just it's just my own personal um, reasoning for when I'm talking to people, and I understand what they're talking about. We are a unique group, and and it's different. Medicine will affect us different than other people, and I'll get into anything about medicine later on, but so I don't know what I'm trying to ask.
I hear you. I hear you. I'm going to summarize. So, yes, there are genetic differences, and certain guidelines may not apply to as well to people of color as to other people. So, some of that is true. Like historically, with kidney disease, for example, that's when you look at the creatinine and the GFR, and in some of those instances, the formulas were skewed to make Black people have higher numbers than they actually did. And those race coefficients were removed in some of those formulas by the Texas Kidney Foundation, and they've done tremendous work in that. But that being said, we are more similar than we are different. So I don't want you to leave here thinking that, well, A1C of 8 in a black person is different than an A1C of 8 in a white person. That's not really how it works. Uh, a lot of the normative data that people are getting is yes, communities of color are disproportionately represented in clinical trials or anything. So that's why with a lot of new medications, what's considered normal a lot of times does not may not be as normal in populations of color simply because they're not as included in the baseline studies. And that's why clinical trials in communities of color, there's a very high interest in enrolling patients in ethnic minorities in these type of trials. But there's been a lot of stigma with these trials and a lot of distrust in the healthcare system with these trials. So I think one of the things that we're going to do in our nonprofit is actually be a venue where it could be a safe space where people can learn more about clinical trials, can get access to some of the newer medications if needed. But at the end of the day, we're really focused on health. I am not a big fan of our disease management model of healthcare where we wait till you get as sick as possible before we treat you. I really want us to change that. I want us to get as healthy as possible so you don't actually ever need treatment. That would be my ideal world. And that's one of the reasons we're starting these clinics so that people can be empowered to have control over their health through information and access to healthcare experts so that when they encounter a healthcare problem, they have a safe place to go that they can access timely and they can receive timely treatment. Now, we can't do everything, but we can be a very safe starting place. For example, the average person, even if they have medical insurance, they're going to wait about 26 days before they get an appointment with their physician. And that's if they're seeing a physician. And it's a lot worse when it comes to specialties. And one of the things we're very proud of is that at our nonprofit, we often will have different specialists who are able to come and share their expertise. So as we gain more funding, we're going to have more days where specialists can come. We can have a robust network of patients and interested volunteers so that, let's say, every Tuesday of the month, we're going to have a cardiologist. Every Wednesday of the month, we'll have a neurologist. And we can start building this rhythm where you could get access to specialty care and information without the burdens and the hurdles of health insurance. There will be limits in terms of what we can actually provide, but information is very, very critical. And if you don't know, then just having that access or a safe place to gather that information, that puts you in a different stratosphere in terms of managing your health.
Yes, yes. Yeah. Now I'm gonna go back on something you said earlier about nutrition. How important is nutrition side of staying healthy?
I mean, as you know, I'm no longer in my 20s or 30s, and I'm discovering you can't eat what you used to eat in the last decade and expect the similar results. And it's very true. You are what you eat. We hear that over and over and over. And I believe as we get older, it becomes more and more true. You become what you eat. Now, nutrition, food is medicine. Make no mistake about that. So, what you're eating has a direct correlation on your health, how you feel, your cognition, everything. And part of the issue is that our traditional American diet, we've traded convenience for health. So, a lot of what we eat is convenient and not as healthy. And that goes down to even the grocery stores. Like, yeah, you're buying vegetables, you're buying healthy foods, but a lot of our foods are really modified. They're very high in sugar, trying to find things that are actually natural and what your body is designed to digest becomes harder and harder. I mean, just look at apples. Apples have never been this sweet and delicious,
Hmm.
but at the end of the day, there's still a very high sugar content. So you have to be very cognizant of where you're eating if you want to maintain a healthy lifestyle. And yes, it's still better to shop wherever you shop and cook your own food than eating out or fast food because a lot of food that we're eating is can be highly processed. And if you're buying packaged foods, if you read the label, you'll notice that a lot of times it says food product, not actual food. It says food product. And you start questioning, what's a food product? I thought it was food. Well, it's not really legally defined as food. It's defined as a food product. So when you start going down the rabbit hole of what you're eating, it's going to change how you look at things.
You're absolutely right, because I read labels faithfully when
Oh,
I go to the
ooh, ooh,
store.
you're reading labels. That's oof, mm.
And I said, no, I'm not getting this. No, I'm not getting that. No, 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 no.
We don't want you
Byproducts.
to starve. We don't
Uh,
want you to starve. If you read the
no,
labels, yeah, yeah.
I read it, and then I will go home, and I will get everything I need to make the same thing that's packaged. And I could do it myself. And right now I'm getting ready to plant my spring garden, which is going to be a lot of herbs and you know things that I eat every day, seasons and all that stuff. So I don't have to worry about anything. So somebody just put down, said the rabbit hole is extremely deep. but we got to be careful on what we put in our mouth and what we're eating, because I am, you know so right now I could go to a restaurant right now. If my wife said let's go out and get something for lunch, where are we going? I want to know. I went to one restaurant one time and I started eating a little bit. I said I can't eat this, and the lady said what's wrong. I said it's too salty. I said I can't eat this, I'm sorry. So once you go ahead and you start a regiment, um, right away when you go eat somewhere else, you notice the high sugar and salt in
Yeah.
that, and that's something you've been eating all these years until you start changing your lifestyle, and you realize I've been eating this all these years. It's crazy, but like you said, it's convenience.
It's convenience. And one thing I highly recommend, and it's very biblical, is fasting. Now, when you start fasting, it's giving your body a chance to really heal itself, and you're going to start changing your taste buds and your cravings. So, like a good 3 day fast, and that's really a real fast is really water, but I mean, you start somewhere. Start by just fasting, cutting out all the processed foods. I promise you, if you just start a fast and say, I'm not eating anything in a package, you are going to go through sugar withdrawals. It's unpleasant, but afterwards, you're going to notice that you think more clearly. You're going to feel better. Whatever aches and pains you have will typically get better because a lot of our arthritic pain, joint pain, muscle pain, it's actually inflammation and it's secondary to sugar or a lot of artificial foods that our body's just not used to. So you're going to retain more water as well. So when you start getting rid of that inflammation, that water weight, you actually start feeling better and you're going to lose weight.
Yeah. Wow. I'm gonna touch base on something that I watch these crazy commercials about all these new pills and all this new that. And then they turn around and say side effects.
Uh-oh.
And when they start mentioning them side effects, I looked at my wife. I said, I'm better off not taking that medicine at all. Listen to these side effects. So I know they got to put that on as a disclaimer, but I think right now we're so busy pushing pills out to fix everything. It just doesn't make any sense. 'Cause when I was growing up, we didn't have all that medicine. Y'all, I'll tell you what medicine we had it in. Like, I don't know who invented castor oil. I don't know who invented that, but that was an all-purpose medicine for everything. But now they pushing out medicine right now. They come up with diagnose. You got this. You got a new pill for this. A new pill for that. Are we getting pill happy in the United States?
Well, the answer to that is yes. Now, I don't want you to take this the wrong way. We have a amazing healthcare system that's probably better than the majority of the world, all the flaws included. But the problem with our healthcare system is that our healthcare system is also a very lucrative business. So we're in the business of healthcare. And your incentives are going to drive the results that you get. And the incentive is for management of chronic illness or the treatment of very complex illnesses at the final portions of life. And that's the most expensive care. How much is one more day of life worth? How much is one more year of life worth? And when you're focusing on those areas to extend life and prolong a life that's been very stressed, yeah, you get really, really amazing and specific drugs and treatments and surgeries that will prolong life, but it doesn't actually promote health. So our healthcare system isn't really designed to promote a healthy lifestyle. It's really designed to combat disease at its later state or to basically fight disease, not so much to promote health. And everything we do is targeted at disease, whereas I believe we should really focus on promoting health, and that'll prevent you from getting to that state of disease management.
Mm. I was just on a roundtable um, this past Monday talking about healthcare on how it's got out of control, and somebody said it at the table that a friend of theirs had cancer, and it was a medicine they could take. They couldn't afford the medicine, and that was one of the part, right? Affordability is what's hidden is hitting the United States, and especially in the rural, not the rural neighborhood, but underserved, is really hitting the people right there because they can't afford that medicine.
Yes.
And so
Where
healthcare,
health insurance comes in play,
yeah,
pharmaceutical industry and health insurance, it becomes really impossible to afford health care, like really complex, critical health care without health insurance. And that's really a consequence of if you have a severe illness or a progressed disease, then you're in a state where it's too late for prevention and you really do need the disease management. We don't have an answer to that because in America, we're blessed where we can treat patients who can't afford to pay. Other
mm,
nations, if you can't afford to pay, you die. And that's one way of doing healthcare. But if it's my family member or my brother or myself, I want everything that can be done for me. So it's this
yeah,
really complex ethical and honestly financial puzzle that has birthed our really bloated healthcare system because we can treat so many different things and we can extend life. I mean, we have, for example, we have ECMO. If you don't have a beating heart or, or working lungs or working kidneys, we can still keep you alive. You're just in the ICU with an ECMO machine, with a ventilator, and you're getting dialysis, but we could keep you alive. But how much does each day like that cost? And
yes,
who's going to pay for it? And that's why health insurance, that's why it exists, and that's why it can be so frustrating. But for our basic primary preventative care, that's something that I believe that we can really start taking charge of ourselves and create systems that can promote health so we have less and less people ending up in these end stage conditions secondary to prolonged chronic illness.
okay, all right. So now we're gonna switch back again for what you on here for. I just had to get those that little bit in there. So what you opening up on the south side and everything's going on, you're talking about your clinic is there and you're looking to expand as things go on.
Yes.
So what was some of the how can I put it? You already talked about it already, how you had to wait a little bit and do this. So what are some behind the scenes that you have done to make this opening happen?
Well, really, it's been networking. So having individuals, doctors, nurses, volunteers who are interested to serve, it's it's been a blessing because a lot of healthcare professionals have very generous hearts and they want to serve. So my mission is to create a very simple clinic where people can volunteer and serve. For example, we do partner with another nonprofit, ICSIS Healthcare System. They provide us our electronic medical record and some protection for our volunteers. So this allows us to keep records of what we're doing and to serve using an electronic medical record. We have different physicians who are able to volunteer, notably the San Antonio branch of the National Medical Association, the C.A. Whittier Medical Society. We have physicians who volunteer their time and efforts. We have the Texas Kidney Foundation who connects us with other community leaders who has funneled patients to us so that we can serve. So it's really creating this ecosystem of physicians and non-physician providers and patients who can access our services and then benefit from it. So this clinic is a way as is our introduction to create something self-sustainable. Right now, we're planning to open 1 day a week, but the good news is we have the location. It's our location. So depending on funding, we'll be able to open 4, 5 days a week. We could open on the weekends, but it's really limited based on funding. And our vision is to create this patient-funded clinic. Yes, we'll have some larger donations from businesses, from larger individuals, but we want to create a healthcare system that can be supported by any community. So, yes, we will provide free care, but we do want to have some level of cost. For example, the cost of a copay, $25. $25 to see a doctor, to get medications, to get expert advice, to get physical exams. If we can keep the cost of care at that level, $25 to $50, that makes it accessible. That's cheaper than your cell phone bill. That's cheaper than cable. So at some point, you do have to put some value on your health, but making it easy, accessible, and also friendly, where you know you're going to an environment where people actually care about you. They're not there seeing you based on your health insurance. You're not discriminated based on your health insurance. You have Medicaid, you have Medicare, you have Blue Cross, you have like, well, we don't see this. You don't have to worry about that. We just get to see you. And if you're able to have access to something like that, you share it and more people support it. And then we create a movement where the patients are now taking charge of their health. Your health shouldn't be dictated by a physician that you can only see twice a month due to your twice a year due to your health insurance. Because, life happens. You may not have your health insurance. You may get sick in between your 6 month follow-ups, or you may need something else. So if we create a system where you have access to an expert that can give you advice or even take care of these minor problems for a fraction of the cost, now you're not limited by health insurance. You're being empowered on managing your health, and that's what we want to provide to the people.
So, how do you go about um, to get doctors to come in to help out?
So blessedly, I am a physician, so I am in a lot of physician circles. So that makes it really easy. I just say, hey, would you like to volunteer? And one of my other roles, I do serve as the president of the San Antonio branch of the National Medical Association, known as the C.A. Whittier Medical Society. So I always have an open door for individuals who'd like to serve. We have some retired physicians who may be interested. We have um, physicians in training, medical students who often would love to give services. We also have access to pre-medical students who are interested in serving. So I'm already in this ecosystem of medicine where people are looking for opportunities to serve and to actually learn. So, at least where we're strategically located and just how I fit in the medical community of San Antonio, I do have a lot of access to physicians and healthcare workers who would like to volunteer. So that makes that portion easy. The hard portion is always with a nonprofit is funding. So my wife and I, we have a private practice, Kingdom Healing Institute, that we use to help fund a portion of the nonprofit. We still have donors, but God made it very clear that we had to step out on faith. We started with the nonprofit. We used to work full time, had very, very comfortable jobs. And then God said, all right, step out the boat. So we stepped out the boat and we became entrepreneurs. We built a private practice outside the insurance system. But our private practice, we do provide concierge level care in neurology, epilepsy, wellness, brain health, pain medicine, addiction. And in this practice, we're able to generate revenue, and a portion of that revenue has been used to build the nonprofit and allows us to have the time to meet individuals and other organizations who help fund the nonprofit as well.
Okay, man. I tell you, well, there's people out there, and I know a couple. When I see you Monday, I'm gonna give you a couple phone numbers. of individuals that help out nonprofits, and
Yes.
I'm thinking that it's going to be a good fit.
Yes.
Just thinking
Right
about it.
now, yes, right now we do have a need, and if we're aiming to raise a recurring income of $10,000 a month for the clinic. But a base operational of about 7,000 will allow us to really open the clinic full time and serve the community without this constant grind for fundraising.
Yeah.
So we want to get to the point where we have $7,000 a month in recurring donations because we always will get one-time donations, generous donors, but that makes it hard to plan. So when we have the $7,000 a month of recurring donations, that allows us to really structure and serve because the beauty about preventative medicine, preventative care, it's not expensive. It's a lot cheaper than going to the emergency room. It's a lot cheaper
Mhm.
than a cath. It's a lot cheaper than a surgery. It's just, hey, your numbers are off. Let's start working with you and let's hold you accountable and let's see you back in a week or 2 weeks or have one of our volunteers call you and keep you accountable. So, yeah, how's that dieting going? Or did you said you were going to get rid of all those chips in your pantry? Like, so let's do some FaceTime. Let's take a look. And when you
Yeah.
have that level of accountability, you're going to see outcomes. If we are making it easier for you to start changing habits, then all the results will change. So let's just focus on the habits. Let's focus on that entry level before we progress to a decade of not seeing a doctor or 20 years of not taking medications.
Yeah, that point right there. In closing, how can people volunteer for you, and how can they donate to your cause?
So you can visit our website, kingdom-hcs.org, or you can visit our general site, Kingdom Docs, and that's where my wife and I advertise our private practice, our nonprofit, and our medical ministry. There'll be links there to donate. And if you'd like to volunteer, just use the contact form on our website, send us your information, and we'll get back to you. We do have a volunteer application, and there's multiple ways to donate online. Just click the donate button. You could donate monthly, you could donate quarterly, once a year, however you want. But and more importantly, show up to the grand opening. We're really excited that people get to see it. If you have access to small businesses, podcasts, where we can start sharing more of this message for San Antonio, that we
Hmm.
would. I love speaking. I love sharing my vision, my heart to serve, and that can help spread the message and get more people actively involved in managing their health. And we at this point, I want to create a system that the next time we have this a crazy pandemic or something where everything shuts down, well, people still know there's a safe place where they can get access to information that's really based on them, on being healthy, no agendas, just the love of God. We're just here to serve you. We don't get paid more by insurance. We don't get paid less by insurance. We don't get paid at all by insurance. We just want to serve and accomplish our mission to show the love of God to all people through healthcare.
And everybody, by the way, WSAN Radio will be there for the grand opening.
Yeah, let's go.
Yeah, we're gonna be there because I'm gonna show up and show about. No, I'm just gonna maintain
Hey,
this.
no,
You
no,
know,
show out. Show out.
I do remember one thing you said at one of those events with Coach K. Use it or lose it.
Hey,
And we've been saying that ever since you said that. Me and Coach K be talking. Hey Ron, you know what the word I said? Use it or lose it.
real. It's real. Your body is made to work. You need to use it. You need to
Yes.
use it. That's how you can age gracefully. That's how you can maintain. But if you don't
Hmm.
use it, it atrophies. We are, as human beings, as spiritual beings, we're never the same. We're either growing or we're decaying. It's life or death. There's no stagnation. Like that's not an option. So if you can only grow or decay, I think you should choose life. Choose growth.
Yes, that we do. All right, sir. We appreciate you taking time out coming on today, and I will see you Monday morning.
Let's go. Monday, 12 noon, grand opening of the Kingdom Healthcare System.
Give that address again.
It's going to be at 4025 East Southcross, Building 1, Suite 5. But you're going to see a whole bunch of people standing outside the building. So drive around that medical complex, and when you see the tents and all these beautiful people out there, you know you're in the right place.
There you go. All right, so you take care. We'll talk to you later.
Thank you, and God bless.
Okay. Thank you for tuning in to WSAN Radio. Catch us on our YouTube channel, WSAN Radio SA. Subscribe to our channel and hit that notification button.